here, if you have kidney issues and you want to get better, keeping the levels for certain vitamins in the right range will make a huge difference. Vitamins really are crucial to repair your kidneys. In my career, I've met several people who were able to reverse kidney disease. All of them had to find a way to get a balanced vitamin intake. But about 80% of people with kidney disease have one or more vitamin deficiencies, which is unfortunate. Even a small vitamin deficiency can make kidney disease progress faster.
I didn't know that either.
We need to avoid this. Best way to do that is to learn how to listen to our own bodies. You see, when there are deficiencies, your body will warn you about a possible danger in certain ways. And there are 7 signs that we should never underestimate. They may be your body's way of telling you that some nutrients are missing and that if you don't do something, things can become serious. So let's start immediately. Number 7 is muscle cramps. Muscle cramps are so common in people with kidney problems, some patients are even told to just power through them.
It's a bad idea.
Don't do that. Muscle cramps and muscle pains are usually caused by electrolyte imbalance, and there's especially one mineral that we must make sure is not too low. And while this will be surprising for some, having too little of this mineral is not as rare as you may think. I'm talking about potassium deficiency in those with CKD. Potassium is usually too high, hyperkalemia, and patients are told to limit their intake. However, thinking that every single kidney disease patient has too high potassium level is not just wrong, it's very dangerous. Having hypokalemia causes muscle cramps to begin with, but if left untreated, it can even cause rhabdomyolysis, which is a very serious condition. It can damage the heart and kidneys. This is not common, so don't worry too much about it. But don't think that if you have kidney problems, your potassium is always gonna be too high. And also, keep an eye on sodium intake if you have muscle cramps. Excess of sodium is also linked to this issue. You see, sodium and potassium are the two ways the brain tells the muscles to contract or relax. Sodium is used to contract the muscles while potassium is used to relax them. So having muscles that cannot relax is often a sign that there is not the right balance of sodium and potassium in the body. Now, another very underestimated sign that a vitamin is deficient is excessive fatigue. Just like having muscle cramps, it's extremely common for those with kidney problems to suffer from fatigue. And while it's true that kidney problems do cause this symptom, we should never let it go unnoticed. It may hide a dangerous vitamin deficiency. Number 6 is vitamin B12 deficiency. The reason why I'm telling you not to underestimate a vitamin B12 deficiency is that this is a very common problem. Just in the US, there are more than 3 million cases per year. And those following a plant-based diet are at risk. We can only get B12 from animal-based foods and from supplements. So if you are following a plant-based diet and you are not supplementing B12, well, that may be causing fatigue. Question: how to tell if you have a vitamin B12 deficiency? Apart from some specific symptoms like fatigue, joint pain, and dizziness, a B12 deficiency can cause a pale yellowish skin and a sensation like pins and needles in the hand. Luckily, correcting this common deficiency can make you feel more energized and can help your kidney health. This is because this vitamin is essential for blood formation as well as brain and nerve function. It's especially useful for people with kidney disease to find a way to get enough vitamin B12 day by day. What's the recommended daily dose for vitamin B12? Intake of vitamin B12 should be from 2 to 6 micrograms per day. But since many people have trouble absorbing this vitamin, many supplements have doses even 100 times higher than that. While it's always best to consult a doctor, vitamin B12 doesn't cause serious side effects, and some people even use it as an alternative to coffee to feel more energized. Next, a sign that very few people will link to a vitamin deficiency: seeing red on your toothbrush. When someone has gum problems, the first thing they will be think about is plaque or maybe a gingivitis, as these are not very serious issues. Generally, they can be improved quickly by brushing the teeth more frequently and flossing. However, in those with CKD, gums that bleed too often may be a sign of a more dangerous issue. Number 5 is vitamin C deficiency. Now, vitamin C is not something you want to be deficient in, not even slightly. It is crucial for many body functions, including wound healing, bone and tooth health, heart health, and immunity. But we must understand that many of foods people with CKD are told to avoid are also some of the best sources of vitamin C. Oranges, tomatoes, potatoes, broccoli, Brussels sprouts are all on the avoid list. This is why vitamin C is often too low in those with CKD. Make sure this doesn't happen to you. And gums problems are one of the earliest signs of vitamin C deficiency, but not the only one. Vitamin C is also one of the body's most important antioxidants. It helps prevent cellular damage by neutralizing free radicals that can cause oxidative stress and inflammation in the kidneys. Oxidative stress and inflammation have been linked to many chronic illnesses, including heart disease and diabetes, so this vitamin may even be used as a therapy for those with CKD. I've talked more in depth about this in my video up here if you miss it. Our next symptom is even more dangerous and even easier to misunderstand. Cold hands and feet. It's winter, so having cold hands and feet may be perfectly normal. But if this also happens when other people are instead feeling warm, it may be a sign of a common and dangerous nutritional deficiency. Number 4 is iron deficiency. Iron deficiency is linked to anemia, and it's a condition extremely common in those with kidney problems. When you don't get enough iron, your body may have problems making enough red blood cells. Red blood cells carry oxygen to tissues and organs. So if you don't have enough red blood cells, you're going to feel really bad. And the kidneys need this precious oxygen too. Like any other organ in the body, they're not going to be healthy if they don't get enough oxygen. Other signs of this deficiency include headaches, problems with concentration, paleness, and dizziness. Now, supplementing iron and improving our diet is extremely helpful if you have been diagnosed with this deficiency. But there's a lot more to iron deficiency anemia. Treating this condition may be vital to improve kidney function. This is why I've made a full video about it. It's up here if you miss it. We're in the top 3 now. These deficiencies have some of the most serious implications. If you have any of the signs we are going to see now, don't wait. Talk to your doctor. Number 3 is a swelling in your neck. Having a swelling in your neck, a condition called goiter, is a tell sign of one of the most dangerous deficiencies, iodine deficiency. Now, this deficiency is more common in people following a healthy diet, and this makes it especially dangerous. You see, the thyroid basically runs on iodine, and trust me when I say that you don't want that organ to give you problems. Never underestimate the importance of your thyroid. If it doesn't work well, symptoms may seriously affect your kidneys and many other parts of your body. Symptoms of serious iodine deficiency include enlargement of the thyroid gland causing a bulge in the neck or goiter, but also fatigue, constipation, sensitivity to cold temperatures, and in some cases unexplained weight gain. What you may not know about iodine is that table salt, which is usually enriched with iodine, is where most people get this mineral. Question: how much table salt do you have in your diet? If your answer is not at all, consider this. According to studies, iodine deficiency is one of the most common nutrient deficiencies, affecting nearly a third of the world's population, and vegetarian and people who don't use table salt are more at risk. Always make sure your thyroid is in good shape. What you need to know about thyroid problems is that in many people with kidney disease, iodine deficiency is not the only cause. Mineral and bone disorder, a common complication of CKD, can also cause thyroid problems. Good news is that there is a solution to both these problems that may make a huge difference in slowing down kidney disease. I'll talk more in depth about these in my video up here. Watch it now for more. Time for our number 2 now. This is a sign that's often ignored. Never do that if you care about your kidneys. Number 2 is brittle nails and dental problems. In people with kidney disease, having frequent cavities or nails that are too brittle or weak may be a very important sign of a vitamin deficiency, especially common in those in the advanced stages. I'm talking about vitamin D deficiency. There is a very important link between dental problems and rapidly declining kidney health. Vitamin D deficiency is actually caused by decreasing kidney function. The kidneys are the organ that convert vitamin D from foods into a form that the body can use. This is why if someone has kidney disease and cavities that are too frequent or nails that are too brittle, they should look into a vitamin D deficiency. Now, if you let these signs go unnoticed, unfortunately, the next thing that happens is a bone fracture. You see, when patients break their bones too frequently, it's normal for doctors to think about a vitamin D deficiency, but you can catch that before it causes serious problems. If you pay attention to your body, this is especially important because vitamin D levels that are so low you break a bone are also going to make kidney disease progress faster. Question: how to tell if you have low vitamin D levels? A lack of vitamin D may cause fatigue, joint, bone, back and muscle pain, but also hair loss, frequent infections, low mood, and depression. Now, if vitamin D levels drop too much and there's a real deficiency, cardiovascular conditions, autoimmune problems, neurological diseases can happen. Now guys, if you have one or more of these symptoms, do a blood test to assess vitamin D levels, even if you are already taking a supplement. As I was saying, low vitamin D may be caused by CKD progression, but that doesn't mean it cannot be treated. Okay, what can be even more dangerous than that? Well, our number 1 is a serious sign that something is going wrong in the body. If this happens, don't wait to take action. Number 1 most dangerous sign of nutrient deficiencies is loss of muscle mass. If you are losing weight at a too fast rate, even if you don't need to, it may be a sign of malnutrition. Unfortunately, malnutrition is common in people with kidney disease, especially in those in the advanced stages, and it's also very dangerous. You see, malnutrition is caused by lack of amino acids, a very important nutrient deficiency. This may cause a cascade of health problems, including rapid loss of kidney function. Now, what you need to know is that following a low-protein diet may cause a lack of amino acids. On the other hand, the low-protein diet is a must for those that want to slow down or even stop kidney disease. What this means is that properly planning the diet is also key to fight kidney disease. If you want to learn more about how to plan a diet that stops kidney disease, watch my video up here. And this is all for today. Thank you for watching. God bless.